Hello. Today we are going to discuss pre-op surgery requirements and getting ready for bariatric surgery. We are going to discuss what to expect during the pre-op testing appointment, how to prepare for surgery, what to expect at the hospital during your hospital stay, discharge information, preparing for the pre-op and post-op liquid diets, and your diet advancement after surgery. During the pre-op testing appointment, this will occur 1 to 2 weeks before your surgery. This must occur in order for you to have your bariatric surgery, so please complete this on time. The pre-admission testing visit is scheduled in coordination by your office surgery scheduler. You do need to be fasting for this appointment, so nothing to eat or drink after bedtime the night before your appointment. If needed, you can take medication in the morning with a small sip of water. It is important that you arrive 30 minutes early to your appointment so you can get signed in and registered with the hospital prior to the start of your appointment time. Testing can take several hours, so be sure to prepare for that. You will go through various departments at the hospital, including lab, EKG and chest x-ray, and getting an ultrasound of your abdomen. During the pre-op testing appointment, the pre-op testing nurse will review medications with you and alert you of any changes that need to be made. So please bring a list of those medications with you so they can be cross-referenced with your hospital chart. After surgery, you can take pills, so no need to crush or liquefy your medication unless specifically told to do so. We do recommend that you take one pill at a time to increase the tolerance of those medications after you have surgery. There are a few medications that you'll need to stop in preparation for bariatric surgery. The most important being NSAIDs, any type of non-steroidal anti-inflammatory drug. The list here summarizes a few of the more common names, but if you aren't sure whether or not you take an NSAID, please discuss this with your surgeon before surgery. We also ask that you stop all vitamin and mineral supplements 1 week before surgery, whether those are over the counter or prescription. For patients with diabetes, you may need to change the way you take your diabetes medication when you start your pre-op liquid diet. So discuss those recommendations with your surgeon or healthcare provider prior to starting the liquid diet before surgery. When you come in for your pre-op testing appointment, you'll also receive instructions about using chlorhexidine. Chlorhexidine is a special type of body wash that will help thoroughly cleanse your skin and reduce your risk of post-op infections. This will be provided for you at the hospital along with instructions on how to use it. After surgery, you will be able to shower the day after. So within 24 hours after having surgery, you should be able to shower. We ask that you not scrub or pick at those incisions. It is normal for them to be itchy. Just pat those dry with a clean towel. You don't need to cover your incisions or anything like that unless you're specifically told to do so. Prior to your surgery, you should be receiving all of the prescriptions that you need for afterwards from the doctor's office. The goal is that you pick these up from your pharmacy before surgery. That way they are home waiting for you when you get home from the hospital. You will receive medication to help control nausea, to help control pain, and to help prevent constipation. If you have a gallbladder, you may also receive a prescription to help prevent gallstones during the rapid weight loss period after your surgery. When you are preparing for your hospital stay, it is important that you bring your insurance card and photo identification with you. If you use a CPAP or BiPAP machine at night while you're sleeping, please bring that with you and know what your settings are. We'll use your machine if it's needed. Loose-fitting, comfortable clothes if you'd like to bring your own bathrobe, pajamas, etc. Feel free to bring those with you. You will be up and walking quite a bit, so if you want to bring your own slippers or shoes to walk around the hospital in, you're welcome to do that as well. And then any just daily personal hygiene products or comfort items you'd like to leave at home, feel free to bring those with you as well. It is important we ask you to please leave valuables, cash, etc. at home so they don't run the risk of getting misplaced or lost while you're at the hospital. On the day of your surgery, you need to arrive 2 hours before your scheduled surgery time to the main entrance of the hospital. From there, they will check you in and take you back to the pre-op area to start prepping you for surgery. They will review your medical history, start your IV, sign and review all of your consent forms for surgery and anesthesia. The entire surgical team will come speak with you, ask you a series of questions in preparation for surgery. They'll also start administering medication at this time to start your pain and nausea control before you ever go into the operating room. Once you are prepped and ready, you'll move into the OR, and surgery typically takes an hour to an hour and a half to complete. When surgery is complete, you'll move to the recovery room, also called the PACU, where we will ensure you are waking up from anesthesia, vital signs are stable, pain and nausea control are getting started before you move upstairs to your hospital room. With bariatric surgery, that will be performed laparoscopically, which means you will have several small incisions around your abdomen like you see in the photo on the left-hand side of the screen. Most of the time, inside those incisions, there will be some stitches. These are the types of stitches that will dissolve over time. They don't have to be removed later on. But if you feel some pulling and tugging as you're moving around after surgery, it's typically those stitches that you're feeling. On the outside of your skin, the outer layers will be closed with glue, like super glue for your skin. That glue will start to peel off several days after surgery. You want to try your best to leave it alone and let it do its thing and not disturb that glue while your body is healing. Once you enter your hospital room on the surgical unit, you will typically stay overnight, just one night after surgery. Family is welcome to come visit you. They will be more than welcome to wait in the surgical waiting area as well while you're in surgery to wait for updates from the staff. Immediately after surgery, as soon as you're awake, you will be able to start consuming some ice chips and sips of clear liquids. You will be receiving multiple medications as needed for pain and nausea management. We are also very proactive about blood clot prevention here as well. So you will receive at least one dose of blood clot preventing medication, in addition to having compression devices around your lower legs and being encouraged to get up and walk as much as possible after surgery. Activity is a very important part of your recovery. We encourage you to start walking as soon as possible, whether that's getting up to go to the restroom, refilling your water jug, or just walking laps around the hospital unit. It is important for your recovery to get up and move as much as you can. The morning after surgery, you will begin stage 2 of your bariatric diet. Stage 2 includes full liquids and protein shakes, something that we will discuss in just a moment. Pain, nausea management will continue. Blood clot prevention will continue in the form of those compression devices and activity level. It is important that you stay up and moving around as much as you can before discharge and when you get home from the hospital as well. When you get home from the hospital, it will be very important for you to stay on top of your pain control. It's much harder to control pain when it starts to become unmanageable. So it is important that you take the medication as prescribed. If you're having trouble with your pain management, please reach out to your surgeon or your provider's office for assistance. Same with nausea. If that nausea starts to get out of control, it can affect your ability to stay hydrated. So be sure that you're using the nausea medication that you have to help control those symptoms. It's also really important that you stay active. You want to walk and drink like it's your full-time job after surgery. You will continue this stage 2 diet for 2 weeks. And it is important that you follow any lifting restrictions set for you by your surgeon, typically about 15 to 20 pounds for the first couple of weeks. If you have an emergency medical concern after surgery, we do encourage you to come back to Tempe St. Luke's. That way your surgeon and their team are here and available to help take care of you. Most of our patients are off work for about 1 to 2 weeks, maybe up to 4 weeks, depending on what you do in your role. So please communicate that with your surgeon and your surgical team. Them, with the help of you, will decide when you are ready to go back to your activities of daily living and get back to work. Quick reminder about things to avoid after surgery. NSAIDs of any kind, so primarily ibuprofen or anything with ibuprofen in it, does need to be avoided. Oral steroids, especially in the first 8 weeks after surgery, do need to be avoided. If you are prescribed oral steroids for some reason, please consult with your bariatric surgeon before you take those medications. Smoking anything of any kind is not recommended after bariatric surgery, in addition to nicotine in any way, shape, or form. And carbonated beverages also need to be avoided, whether it's carbonated water or soda and soft drinks, etc. Next, we're going to talk about the pre-op nutrition information, specifically the liquid diet before surgery. The pre-op liquid diet is either 1 or 2 weeks long, depending on your BMI. If your BMI is 50 or above, you will be required to complete a 2-week liquid diet. The liquid diet is a very important step because it actually helps prepare your body for surgery, helps reduce the size of your liver, reduces the amount of internal fat surrounding your internal organs, and in doing this is going to make surgery easier to complete and reduce your risk of complications during and after the procedure. On the liquid diet, it's a combination of clear and full liquids. It is going to be very low calorie and very low carbohydrate. So it is normal to feel kind of run down and have a lack of energy a couple of days into the liquid diet because your body is just not getting very much fuel. We do want to ensure you're getting plenty of protein, at least 80 grams, if not more, every day. And most of that protein is going to be coming from protein shakes. It's my recommendation that you use a protein shake as your meal. So breakfast, lunch, and dinner is going to be a protein shake throughout that period of time. On the pre-op liquid diet, like I mentioned, it's a combination of clear and full liquids. So clear liquids include things like protein water, sugar-free Jello and popsicles, broth or bouillon of any kind, caffeine-free beverages like herbal teas or decaf tea and coffee, sugar-free sports drinks, Crystal Light, or similar water flavorings that are sugar-free as well. In addition to those clear liquids, you can have items like protein shakes, cream of chicken or cream of mushroom soup, low sugar yogurt, anything less than 10 grams. Options like Oikos Triple Zero, Chobani Zero Sugar, Dannon Light and Fit Greek are all good options. Skim milk or low carbohydrate milk like the Fairlife brand are good options, especially if you're using protein powder to mix your shakes with. Or if you do not consume dairy, unsweetened non-dairy milk like soy, almond, oat milk, etc. are all fine as well. The day before your surgery, you will be limited to clear liquids only. So protein water, your sugar-free Jello and popsicles, low sodium broth, your teas and coffees that are decaf, your sugar-free sports drinks, etc. No milk products, no yogurt, no protein shakes or soups that day before your surgery. Now, before bedtime, the night before your surgery, we ask that you do some carb loading. This is going to help provide your body with some sustained energy to get you through surgery and into recovery, so your gas tank's not on empty. Doing this carb loading helps manage nausea symptoms. It helps control and stabilize blood sugar and gives your body some fuel to get through a stressful surgery. In order to do carb loading, what we ask is that you drink 32 ounces of regular sports drink like Gatorade or Powerade within the hours before bedtime. So sometime between dinner and the time you go to bed. In the morning before you come to the hospital, we want you to drink another 12 ounces of that regular sports drink. You must consume this 12 ounces 4 hours before your surgery time. So if your surgery is at 7 a.m., you have to drink that Gatorade or Powerade by 3 a.m. Once you finish that Gatorade or Powerade, you cannot drink anything else until after surgery is completed. When you are in the hospital, you will start stage 1, which is your clear liquids immediately after surgery, and move to stage 2 the following morning. Stage 2 is where you will stay for the first 2 weeks. Basic guidelines for stage 2 mean nothing you eat should require any type of chewing. Smooth soup and yogurt only, no pieces, no chunks of anything. And you are welcome to dilute or thin out items as you need in order to make them more tolerable. Overall goals for stage 2 are 64 ounces of fluid every day, hopefully by day 3 after surgery. You are going to have to start with very small sips throughout the day and gradually increase your intake from there. Goal number 2 is to achieve enough protein per day. So our hope is that by day 5, you are getting at least 60 grams of protein from protein shakes, which is about 2 protein shakes per day. And finally, goal number 3 is that by day 7, you are able to start tolerating some bites of food. Things like cream of wheat, cream of rice cereal, sugar-free pudding. The registered dietitian from the hospital will come chat with you before you leave, provide some information for you so you know how to eat and drink moving forward. Resources will also be available through your doctor's office and the Tempe St. Luke's website from the Bridges Center webpage. General tips and tricks. Drinking 1 or 2 ounces every 15 minutes over and over, and then gradually increasing your ability to drink from there. Remember to stay away from carbonation. Added sugar is a no-no, so we want sugar-free options only. And it is important to try different temperatures, different textures. If super cold, ice cold beverages aren't settling very well with you, maybe you want to try some room temperature or lukewarm options instead. And then it's so important that you go slow. Take your time, sip really slowly. Think about just getting your tongue wet over and over again for the first few hours. Get something down, and then gradually increase as you can. After surgery, it is going to be required that you take bariatric vitamins. You can start these about 2 weeks after surgery once you settle into the routine. What's required is a bariatric multivitamin plus additional calcium. Most people are just taking 3 supplements a day, 1 multivitamin and 2 calcium supplements. Extra things like vitamin D or iron or B12 are really only needed if lab work tells us that it is. Taking more of those vitamins without deficiency isn't really going to help with anything. So the most important is that you choose a good quality bariatric multivitamin that's been recommended by your doctor's office, and then that additional calcium to help protect your bones from potential metabolic bone disorders later on after surgery. The most common reason people come back to the ER after bariatric surgery is dehydration. Because of limited fluid intake, if anyone's having any nausea or vomiting, or if you're just uncomfortable and not able to drink very well, you're putting yourselves at risk for dehydration. If you are constantly feeling thirsty, if your mouth is very dry, if you're starting to develop a headache or feeling lightheaded and dizzy, or having heart palpitations, those could potentially be signs of dehydration. Be sure again that you're taking those slow, small sips and being very intentional about drinking through the day. Ice chips and popsicles are a really great way to get some extra fluid in if you're feeling kind of waterlogged and not able to drink a lot. And then it is sometimes helpful to have some electrolyte containing beverages at home, like your sports drinks or Smart Water, Body Armor Light, things that have a little bit of electrolyte in them to help with hydration. Another important thing to understand is that your bowel habits most likely will change. While constipation can occur after surgery, most of the time in our bariatric surgery patients, there's just a delay in bowel function afterwards. You have to remember that you've been on a liquid diet for a period of time before ever having surgery. Then going under anesthesia and receiving pain medication slows down your GI function. You're also going to be continuing a liquid diet and potentially having some dehydration after surgery as well. So we're putting a lot of factors into place here that can really slow down the movement of your gut. You also aren't producing a lot of waste because you're not really eating a lot of solid stuff. So it is very, very normal to go multiple days after surgery without having a bowel movement. As long as you don't feel uncomfortable, we don't really get too concerned. If you're having a little bit of bloating or discomfort, be sure that you're using your stool softeners, you're drinking plenty of fluids, you're getting up and moving around. But if you are concerned, definitely reach out to your surgical team so they can help address that for you. So I wish you all the best of luck with your upcoming procedures. Please reach out to your surgery team if you have questions or concerns about anything and getting prepared for surgery.